Now, as we embrace for the monsoon season, while rains bring much needed relief and rejuvenation, they also come with their own set of health challenges. So today on TBC, we'll be focusing on how to stay safe and protect yourself during this season of increased viral infections. You must have heard the headlines by now of different viruses outbreaks in different cities. There is H1N1 in Mumbai, there is Nipah virus in Kerala, Norovirus in Hyderabad.
Right, and the thing with these viruses is they're often confused with the seasonal flu. So most of them will start in a very similar way inside your body. But if we've learnt anything in the last few years, it's don't take viruses lightly, right? Each virus is distinct. It needs a specific treatment. So we thought on TBC this morning, we'd help you figure out the different kinds of symptoms to different monsoon viruses and the respective treatments that you need to engage in. What are the preventative vaccinations that you can even take to prevent them altogether?
So we picked up the three most sort of infamously spreading viruses in the country right now. We'll start with the Nipah virus. It has taken away the life of a 14-year-old, remember, in Kerala. In addition, some 60 people have been identified as being high risk as well in this category of having the disease. And the boy who actually got it and unfortunately died, his entire village and everybody who got in touch with him have been isolated. People in the area, again, have been asked to wear their masks, avoid meeting, avoid going to the hospital altogether. But what is Nipah really and what makes it so lethal? Well, the virus is an infection in a zoonotic illness, meaning it's transmitted from animals like pigs and bats to humans. The WHO is also described this as a priority pathogen because this has a potential trigger of an epidemic. The question is, how should you know that you have Nipah? Number one, symptoms, let's talk about that. It's fever, it's headache, it's muscle pain, vomiting and even a sore throat. If it becomes extreme, it can go into dizziness or drowsiness. It can go to an encephalitis, sort of a situation when there is inflation in the brain. And of course, there are seizures as well. But the treatment here is that there are no drugs or vaccines to cure Nipah infection. Intensive support care, only symptomatic one can be given. So it's absolutely critical that you nip it in the bud, sort of go to your doctor right at the onset if you're feeling something.
Okay, let's take you now from Nipah, which, as we said, we're seeing cases of in Kerala, to Hyderabad. Hyderabad is currently experiencing an outbreak of the Norovirus. It's obviously often referred to as the stomach bug, and that's where the confusion sets in. Now, it spreads through contaminated food, water, surfaces like that. What are the symptoms that you can see? You'll often see diarrhea, you'll see vomiting, you might have stomach pain or cramps. And again, when it comes to treatment, there is no specific treatment of the norovirus, but you do have different vaccinations that you can find at different phases. So at phase 2, there's a particular kind of vaccination that you can get from the Serum Institute of China. You also have quadrivalent vaccines that you can get. These you can get from the Anhui Lonco Biological Pharmacy. And there are other options too. So there's even a monovalent option that you can try to get. At phase 3, you can also try to get a different kind of vaccination. So there are different ways to meet this, as we said, at different phases.
Right. Number 3 on the list that we've picked out for you today is H1N1. Something that Mumbai is really facing and how. It's an outbreak that people are talking about. It's H1N1, influenza cases known as swine flu as well. There is an uptake in these cases and it is spreading through respiratory droplets and affects the respiratory system as well. What are the symptoms you should watch out for? If you have sudden onset of fever, very high fever in most cases. If you have cough, which is generally dry. If you have headaches, muscle and body pain, and you feel severely unwell, not being able to get out of your bed, that is H1N1, not your regular flu. The treatment again for this is not really available. You're supposed to stay at home. It's infectious, so ensure that others do not get it. There is, however, a medicine that comes in that can be given in the first 48 hours of the disease. If you take it, then it's said that the effect of it will be much less. Tamiflu and the rest can be tried out. Apart from that, vaccination also is recommended, but this one is of the kinds that you have to routinely get every flu season, which could actually prevent you about through a particular kind of viruses in a particular spectrum, but you have to take it every monsoon season. Of course, those who are pregnant, younger kids, older people are advised to take it even more, those with chronic diseases as well. But those are some of the basics really that you need to know about these three viruses and viruses in general that hit us every monsoon. But what should you do about it? Well, we've given you all the research, but let's talk to a doctor now. Dr. Pinto is with us, consultant pulmonologist and epidemiologist from Hinduja Hospital. Good morning, Doc. Thank you so much for speaking with us. I want to understand first from you, we look at so many of these viruses, we picked out three, there are about two more, that are really doing the rounds. But the basic question that comes to mind is, if you are feeling a little niggle, if you see the common symptoms for all these viruses, it's been headache, it's been congestion, and it's been fever. If you're feeling any of it, how do you tell whether it's a regular flu or this could be something more?
I think a recurring theme which we saw even during COVID and for most of these viruses is at the end of the day, it's a reflection of your own immunity, which decides which direction you head. So if you are immunocompromised in any way, if you are somebody with diabetes, for example, and your sugars have not been well controlled, if you have cardiovascular disease, if you have lung diseases like asthma, then you definitely don't ignore these symptoms even at an early stage. You try and get swabbed as soon as possible, and therefore treatment can be instituted quickly. Now, if you are absolutely healthy, you're a younger individual, you have a fever, you have a sore throat, you have a little bit of a cough, I think it would be a little panicky to suggest that everybody immediately gets tested, everybody goes all out. So I think it's a reflection of not just the virus, but also your own immunity, your own status, and that's where you take the call.
Dr. Pinto, tell us, beyond the usual that we hear from everyone, the hygiene practices that you need to do. So, for example, making sure you're washing your hands, the very basics. What can we tell our audiences to do to keep themselves safe? Because this is something you hear about every monsoon, right?
I think more than protecting yourself from others, I think it's equally important to tell individuals that if they have symptoms, to try not to transmit it to others. I think that's one place where we tend to lack. If you look at a lot of other countries, when a person falls ill, they immediately mask up. They immediately try to isolate, not go to work, not go to school. I think that's primarily important in terms of your civic sense, to try and make sure that you don't transmit it to others. Now, for individuals trying to prevent getting infected themselves, the usual, try avoid crowded places, try avoid closed surroundings with inadequate ventilation. Mask up when you can, especially if you know that there is an epidemic going around in the city. And of course, the usual hand washing and sanitizing as much as possible.
Right. Dr. Pinto, a lot has been talked about the influenza vaccine that now a lot of doctors prescribe on a seasonal basis. It's said to cover a host of viruses. What is your recommendation? Who should get it and when?
So we definitely recommend it for individuals who are older, so 50 and above, maybe individuals who have immunocompromising conditions. So as a respiratory physician, for example, all my patients with asthma, with COPD, with chronic lung diseases are strongly advised to take it. Unlike the West, where the recommendation is to take it just before the winter, in India, we recommend it before the monsoon because, again, influenza tends to peak in the monsoons in India. We also recommend the Southern Hemisphere strain because a lot of the viral strains seen in India tend to be of the Southern Hemisphere rather than the Northern Hemisphere. And this vaccination typically is advised at the end of May or the first week of June. So again, as a broad statement, if you have immunocompromising conditions such as diabetes, cardiovascular disease, or respiratory conditions, I would strongly advise you to go ahead and take the vaccine annually.
Doctor, every monsoon in families across the country, you have almost superstitious practices that we'll have, right? So typically you'll stay away from eating sometimes salads, vegetables. You'll encourage people around you not to go swimming, especially in lakes or ponds. You also sometimes have families that will say don't eat fish. I just want to ask you, doctor, for kids, if you are a parent, what are the practices that one should actually practice that even you would advise in families to keep yourself healthy in this weather?
I think one needs to be cautious about eating raw foods, especially in the monsoon, because we know the food chain doesn't tend to be very sterile, doesn't tend to be very hygienic sometimes, and stomach bugs are very common in the monsoon. So it's not bad advice to stay away from raw food as much as possible. Children, unfortunately, by virtue of going to school, staying in an environment where so many kids come together, will catch a few bugs here and there. And I think one doesn't need to go overboard. But of course, if your child is lethargic, if your child is not playing, not consuming enough to hydrate themselves, you should see a pediatrician. So very often it's not the virus that causes the problem in the kids, but it's the lack of nourishment, the dehydration that happens as a result of the fever that can cause serious issues. So if you find your child not behaving in a normal way as they normally do, they're not playful, I think reaching out to a pediatrician is extremely important. Of course, encourage your children to wash their hands with soap and water as much as possible. Encourage your children not to touch surfaces when they go out and play in parks, etc., to try and be as careful as possible. But it's always going to be challenging with kids. Kids will play, kids will do things that are not necessarily in their best interest, but they have to play at the end of the day.
Yeah, I was just going to say good luck trying that with toddlers. I have one around and I can tell you, handful, just not possible to do it sometimes. Which brings me to the next question on prevention, Dr. Pinto. Enough and more has been spoken of late about taking multivitamins to sort of up your immunity, especially with changing seasons, especially in the monsoon. Do you recommend it?
So I don't think there is any scientific evidence to suggest that any vitamins really help when it comes to preventing viral infections. I mean, vitamin C has been spoken about for years and years and decades together, but there have been studies which have looked at its utility, and it doesn't really seem to benefit as much. So while as a broad statement, if you are deficient in certain vitamins, if you're deficient in vitamin D, if you're deficient in B12, it's not a bad idea to replenish. But as a broad statement, subjecting everybody to vitamins with the hope that it will prevent viral infections is not really science-based.
Okay, and doctor, if we could ask you, we've focused on these 3 viruses as we started, but I would be remiss to not touch on dengue and malaria for a second in this weather. Just tell us, doctor, with dengue in particular, it's a fever. And it's often hard to tell, is this a fever that I'm getting that's a regular fever? Could this potentially be dengue? Because the symptoms, again, like we were talking about in the beginning, are very similar. So what do you advise to people who are looking out?
So again, as a broad statement, if you are someone who is healthy and is having a fever, typically I would say wait for 24 to 48 hours. If it spontaneously starts getting better, if you spontaneously start recovering, the maximum temperature that you reach gradually starts coming down by itself, then maybe you can just wait and watch. But if it's 48 hours, you're still getting high-grade fever, there are chills, you're feeling unwell, you're feeling extremely drained, you're potentially getting dehydrated and lightheaded, for example, that's when you would definitely approach a doctor. And something like dengue, it needs blood tests, so you would need to look at whether platelets are dropping, you would need to look at whether your tests come positive for dengue, and I think roughly 48 hours would be the cutoff at which you start getting concerned and get investigated.
Right. Dr. Pinto, I also had a larger question on our interaction with viruses. Now, if COVID has taught us anything, it is that they're going to be around for a while and we'll have new challenges sort of come up year after year, if not, outbreaks that will keep happening. Is there any advice that you have for people on how to sort of approach viral diseases as, on the whole? We understand that hydrating yourself is extremely important, but overall, to be able to fight these viruses better, do you have any top 3 recommendations?
So as a broad statement, again, a lot of these viruses are spillover viruses. They spill over from the animal kingdom to humans. A lot of that is happening because of deforestation, because we are intruding into animal territory and therefore causing the spillover of these viruses. So as human beings on the whole, I think we need to start rethinking how aggressive we are about deforestation and entering territories which are not really ours, and therefore respecting those boundaries. When it comes to individuals themselves, I think at the end of the day, everything is a function of the host versus the virus, right? So it's your own immunity fighting a virus which also wants to survive. I think keeping your immunity intact and keeping your immunity as boosted as possible would be the broad advice to individuals. And that's, making sure that your comorbidities are well controlled, making sure that one exercises and stays physically active on a regular basis, making sure that you take the vaccines that you're eligible for and you should be taking, and just sensible nutrition and health practices, which keeps all your comorbidities under control and therefore makes you less vulnerable to the effects of these viruses. At the end of the day, it's the fight between the virus and the human. And I think the human can only win if their immunity is intact and in place.
Right. Right. All right, Dr. Pinto, thank you so much for joining us. The day when doctors start talking about deforestation and climate, that's when we really need to sit up and take note. And I think